Assalamu alaikum. This is Dr. Haider Hamid. Today we're going to discuss part 3 basic anatomical structures, including bones, cartilage, and joints. You'll find the pages on Gray's Anatomy for Students 4th edition from page 12 to page 22. ملاحظة: هاي المحاضرة أعيد تسجيلها لوضوح الصوت عن المحاضرة السابقة. At the end of this lecture, you should be able to define skeletal system, classify types of bones, define cartilage and its types, to describe joint and its types, and finally to describe the types of synovial joints. ملاحظة: ايش يذكر بهذا البرزنتيشن هو مطلوب من عندك للدراسة. Skeletal system is a body system that includes both bones and cartilage. Osteology, however, is a science that studies bones. The prefix osteo means bone. Human skeleton is divided for descriptive purposes into two skeletons: the axial skeleton, الهيكل المحوري, composing of bones of the skull or the cranium, vertebral column, and bones of the thoracic cage, composed of 12 pairs, 12 زوج, 12 on each side, of ribs, أضلاع, and the sternum, عظم القص. And the other type is called the appendicular skeleton, which composed the bones of the upper and lower limbs. Vertebral column is divided into 5 regions. The first region is called cervical region, composing of 7 cervical vertebrae, numbered as C1 to C7. The second region is called thoracic region, including 12 thoracic vertebrae and numbered with T1 to T12. The third one is called lumbar region, composing of 5 lumbar vertebrae, also numbered L1 to L5. The sacrum is basically a 5 fused sacral vertebrae into one piece of bones called the sacrum. And lastly, the coccyx, which is a 3 to 4 rudimentary vertebrae fused into a single piece of bones called the coccyx. The function of bones is to protect vital organs such as the brain within the skull, the spinal cord within the vertebral column within the spinal canal. Bones also act as a lever on which muscles act to move. And also it houses bone marrow and also act as a house for fatty tissue. It acts to support the soft tissue of the body, including muscle and other types of soft tissue, and also give us the shape of our bodies. And finally, it acts as a reservoirs, storage sites for unimportant minerals, معادن مهمة اللي هي الكالسيوم and the phosphorus. There are 2 types of bones basically. The first one is called the compact bone, which usually found on the outer layer of the bones when we cut the bone transversely or longitudinally. Compact, or also called Haversian bones, it's a solid, dense bone. And the other type is called spongy bones, also called cancellous or trabecular. This type of bone composed of small spikes or called spicules of bones that are interconnected with each other, leaving a small cavities between them, which are filled by the red bone marrow. Red bone marrow is the blood cells forming tissues, which found in these small cavities of the cancellous bone. And here you may have noticed that this is a type of bone, it's called long bone. Every region in this bone, if we cut it transversely, we find there is a different pattern of arrangement. عندنا أنماط مختلفة من الترتيب compact bone and the spongy bone. However, we have a consistent pattern. النمط الثابت اللي هو compact bone يكون on the outer aspect, while the spongy or cancellous bone is found in the middle. However, the spongy bone is usually found in the extremities of the bone, نهايات العظم, while in the middle of the bone there is a cavity which is devoid of cancellous bone. Devoid of يعني ما بيها cancellous bone. Only there is a cavity at the تجويف and surrounded by compact bone. هذا التجويف اسمه medullary cavity أو marrow cavity, also marrow cavity. وراح نشوف هذا يحتوي على another type of bone marrow than the. Based on their shape, bones can be classified into 5 types. First one is the long bone. And the long bone is a bone in which their length is much larger than their breadth. Example is the bone of the arm, which is called the humerus. This is the humerus. Bone of the thigh, عظم الفخذ, is called femur, and other types of bones. And we will discuss the long bones later. The other type is called short bones. Short bones هي bones اللي their length is almost equal to their breadth, and they are cuboidal in shape. Cuboidal يعني they looks like a cube. Cube هو المكعب. Example of this type is the bones of the wrist, عظم مفصل المرفق, which is called the carpal bones, and short bones of the ankle joint, مفصل الكعب, which are called tarsal bones. Other type of bones is called flat bones. Flat من اسمها مسطحة. Example of flat bones is the sternum, scapula, لوح الكتف. Bones of the skull are also types of flat bones. Hip bones, عظام الحوض, also flat bones. When we cut a flat bone, we can see it's composed of 2 plates of compact bone separated by a spongy bone. The fourth type is called irregular bones, and they have various shape and sizes. ما نقدر نصنفهم لا هم long ولا هم short ولا هم flat. مثل ايش؟ مثل vertebral column, vertebrae, bones of the face, عظام الوجه, and so on. The last type is the sesamoid bones, and we will discuss this type later on. Long bone is divided into the following. As you may have noticed, the long bone has 2 expanded ends, a proximal one and a distal one, and these ends are connected by a long shaft or middle part. This expanded end is called epiphyses. So we have 2 epiphyses, plural جمع, of epiphyses. We've got proximal and distal epiphyses. The shaft parts of the long bone is called diaphyses. while the area in which the epiphysis is connected to the diaphysis is called metaphysis. So we have proximal epiphysis, metaphysis, or also called proximal metaphysis, and we've got diaphysis, distal metaphysis, and distal epiphysis. When we cut the bone longitudinally in this section, we can see that the epiphyses are composing of spongy bone internally and surrounded by compact bone. In fact, compact bone is surrounding the whole surface of the bone and bones in general, not only the long bones. However, spongy bone is only found in the extremities, in the epiphyses of the long bone, while the diaphysis is composed a cavity, the تجويف. This is called medullary cavity or marrow cavity. And as you already know, that the small cavities of the spongy bone or the cancellous bone are filled with red bone marrow, while the large cavity of the diaphysis, which is also called medullary cavity, is filled with yellow bone marrow, especially in adults. Red bone marrow is basically the blood cells forming tissue, while the yellow bone marrow is fundamentally adipose tissue, fatty tissue, نسيج دهني. Sesamoid bones are a special type of bones. They unusual types of bones, actually. They are found in the tendons of the muscles, especially when these tendons crosses a joint at areas when we have pressure from outside. مثل ايش؟ مثل الفيت, especially in the inferior aspect, lower aspect of the feet, when they are prone to pressure, يكون عرضة للضغط from the ground. Here is the ground. And the tendons of the hand, especially the thumb, the ibham, this is the sesamoid bones, and they are found within the tendons. And the most famous one is the sesamoid bone of the knee joint, which is called the patella or kneecap. This is function as to protect the tendon, because if we have a tendon here without the kneecap, and the tendon will be prone to injury because of an external pressure. All bones in the body are covered externally by a fibrous connective tissue membrane called periosteum. And peri means outside, osteo means bone. However, not all the surface of the bones is covered by periosteum. Instead, there is a small area at which the bones are making joints. These areas that contribute in joint formation is covered by a special type of cartilage called hyaline or articular cartilage. Periosteum contains blood vessels that provides nutrient to the outer aspect of the compact bone of the bone. It also contains lymphatics that drain lymph out of bony tissue, and also contains nerves, and these nerves are pain-sensitive nerves, meaning they are sensitive for pain, either from injury, from inflammation, whatever the insult here that may cause pain. Now, each long bone, especially long bones, they got a single or usually single nutrient artery. Nutrient يعني تغذوي. This nutrient artery usually gets into the inner aspect of the bone through the diaphysis via a called nutrient foramina. And foramen means an opening. This foramen can be seen in dry bones اللي راح نشوفها بالمختبر. العظام الجافة راح نشوف openings in the diaphyses of long bones. This is called nutrient foramina or foramen. Nutrient artery provides nutrients and blood supply to the inner aspect of the bones, which includes the cancellous bone or spongy bone in the epiphyses and the inner aspect of the compact bone. And of course provides nutrients to the bone marrows, including red and yellow bone marrow. Periosteum is very important for the vitality of the bones, because a bone stripped of periosteum will not survive، خاصة بحالات كسر، بحالات العمليات الجراحية على العظام. المنطقة اللي ما متغطاية بالبريوستيوم من العظم ما راح تعيش وما راح تكمل. Cartilage is avascular connective tissue. A prefix A means without, so avascular means without blood vessels. Cartilage is more resilient than bones because it is not calcified as bone. There are three types of cartilage: hyaline cartilage الزجاجي اللي موجود يغطي ال articular surfaces اللي هي ال surfaces of bones that contribute in joints تسوي لي المفصل. Fibrocartilage الغضروف الليفي مثل ال discs between the vertebrae, intervertebral discs. And a special type of joint called pubic symphysis. It's a fibrocartilaginous joint between the bones of the pelvis, عظام الحوض. And lastly is the elastic cartilage, which is a rare in the body. One of the examples is the external ear auricle, سيوان الأذن. Comparing two bones, remember that cartilage is nourished by diffusion and there is no direct blood supply to the cartilage, and there has no lymphatics or nerves. Our third subject is joints, المفاصل. And the joint is defined as the area where two or more than two skeletal elements come together. And these skeletal elements usually bones. Regardless of movement, whether there is a movement or no movement, we call this area as a joint. Basically, there are two types of joints. Either joints with a cavity that separates between the articulating surfaces is called synovial joints, or the two articulating surfaces are connected by connective tissue, and this type of joints is called solid joints that we will discuss later. Synovial joint is a type of joints at which the articulating surfaces are covered by hyaline cartilage and there is a cavity between the articulating surfaces. It is the most common type of joints in the body, النوع الأكثر شيوعا بالجسم, and is the most movable joints, and they got the widest range of motion for the movement of the body. There are general features described in the synovial joints, and as the definition implies, that the articulating surfaces are separated by a cavity. So there is a cavity between the articulating surfaces of the bone. Second feature is that the articulating surfaces are covered by hyaline cartilage, الغضروف الزجاجي أو articular cartilage الغضروف المفصلي. The third feature is that the cavity between the articulating surfaces are sealed by مغلقة by a joint capsule. This joint capsule has got two layers. The inner layer called the synovial membrane, which is highly vascular membrane attached to the margins of the attachment of the hyaline cartilage. نشوف هنا they are attached on the margins على حافات attachment of the articular cartilages. Synovial membrane secretes a special type of fluid called synovial fluid, which is a viscid يعني لزج, viscid and thick fluid that fills the cavity or the synovial cavity or articular cavity. Its main function is to lubricate the articulating surfaces and to reduce friction between these surfaces during movement. تقلل لي الاحتكاك وتسهل لي حركة articulating surfaces during movement. The outer layer, however, of the joint capsule is called fibrous membrane, and this is thicker compared to synovial membrane, of course, thicker fibrous membrane attached to the margin of the articulating surfaces, and it's continuous with the periosteum of the bone. If you remember, periosteum is a fibrous connective tissue covering the external surface of the bone. In addition to the general features of the synovial joints, there are accessory structures that may be associated with some of the synovial joints in the body. The first structure is called bursa. And bursa is a closed sac, كيس مغلق, of synovial membrane and filled with synovial fluid outside of the main joint cavity of the synovial joint. However, it may be as an extension from the synovial cavity or as an isolated sac, such as in this condition. Bursae, جمع bursa, are located between movable structures in relation to the synovial joints. مثلا, in this condition, it lies between the skin and the joint. So it separates the skin from the joints. It also may be present between the tendon and a bone, or a tendon and a joint. And the main function is to reduce friction between these movable structures, to reduce injury, of course. So عندنا movable structure, which is the skin, and here is the another movable structures, and these structures are adjacent to each other. They have to be separated by a bursa to lubricate and reduce friction between these structures. The second structure is called tendon synovial sheath, and it has the same concept as the bursa. However, its shape differs. يختلف شكله. It is a tubular closed sac of synovial membrane, and again it's filled with synovial fluid. Tubular shape يشبه الأنبوب around the tendon, especially when it passes close to the synovial joints, قريب على synovial joints, or sometimes we have some joints and some tendons that pass within the synovial joints, and we will study this later on, inshallah. So the synovial tendon sheath or tendon synovial sheath is a tubular shaped synovial sac filled with synovial fluid surrounding the tendons to reduce friction between the tendons and adjacent movable structure. Third structure is called ligaments, الأربطة. And ligaments are basically thickening of the outer fibrous membrane of the joint capsule. Remember, joint capsule composed of inner synovial membrane and outer thicker fibrous membrane Some parts of the fibrous membrane get thickened تثخن forming cord-like structures تراكيب تشبه الحبل تسمى ligaments أربطة and these ligaments hold the articulating bones together تلزمهن وتخليها تنفصل and they stabilize the joints. The other structure is called articular discs and they are fibrocartilage, special type of cartilage, present within the synovial joints. تصير بكل الجوينتس؟ طبعا لا، تصير ب some joints that are weight bearing joints، المفاصل اللي تتحمل الوزن اللي تكون عرضة to compression، عرضة إلى الضغط، مثل إيش؟ مثل الني جوينتس، من أشهر الجوينتس اللي بيها articular fibrocartilage discs. هذه موجودة ليش؟ حتى first to withstand the compression، تتحمل الضغط. Second, to accommodate the change in the shape of the articular surfaces. During movement، نفرض إنه هذا movement هنا، حتى to accommodate، حتى تناسب شكل articular surfaces خلال الحركة، بالإضافة لأنه it increases the range of motion، تزيد لي من معدل الحركة بهذه المفصل. The last structure is called fat pad or articular fat pad. These pads of fat، مخدات الدهون، present within the joint capsule, of course, between the outer fibrous membrane and the inner synovial membrane. وهذه موجودة to accommodate the moving structures or moving parts of the articulating surfaces of the bones. إذا نفرض إنه هذا الجزء من العظم خلال الحركة راح يطبق على هاي المنطقة، فحتى to receive the bones, the parts of the bone of the other articulating bones into this area. So it acts to reduce compression and for shock absorption. تمتص الصدمات وتتخذ أو تستقبل شكل العظم المتمفصل خلال الحركة. The stability of synovial joint depends on three factors. 3 عوامل يعتمد عليها استقرار المفصل أو قوة المفصل. First is shape of articulating surfaces، شكل articulating surfaces. Second, number and strength of the surrounding ligaments، الأربطة اللي هي cord-like structures اللي حكينا من thickening of the fibrous membrane. And the muscle bulk and tone، حجم العضلات وقوتها حول المفصل أكيد. أكو علاقة عكسية between the stability and the mobility of the joint. علاقة عكسية بين الاستقرار والحركة، بمعنى أنه كل ما زاد الاستقرار أو كل ما زادت قوة المفصل قلت حركة المفصل، والعكس صحيح، كل ما قل استقرار وقوة المفصل كل ما زاد الرينج اوف موشن أو مدى الحركة، كل ما المفصل صار أكثر حركة. وطبعا أشهر مفصلين نقارن بيناتهم هو مفصل الكتف اللي يكون less stable but more mobile مقارنة بالهيب joint اللي هو مفصل الورك اللي يكون more stable but less mobile. Synovial joints can be classified based on two things. First is the number of planes at which the joint moves and the shape of articulating surfaces. So based on number of planes is classified into uniaxial. Uni means one, so the joint moves at single plane. Biaxial, 2 planes. Multiaxial, 3 or more planes. Or according to the shape of articulating surfaces into 7 types that will be discussed individually. راح نناقش كل وحدة على حدة. First type is called plane joints. Plane يعني flat. Flat because the articulating surfaces are flat. The two articulating surfaces are flat. Example of that is a acromioclavicular joint. It's a joint between the clavicle, collarbone, عظم الترقوة, and a part of the scapula, جزء من عظم اللوح الكتف اللي نسميه acromion. فit's acromioclavicular. Acromion and clavicle joint, plain synovial joint. The main movement across this joint is gliding or sliding. حركة تزحلقية. Okay, so it is a uniaxial joint. This is the plain synovial joint. The second type is called hinge joint, and hinge means the joint of the door. Hinge, مفصل الباب. The shape of the articulating surfaces, one of the surfaces is cylinder-like, شبه الأسطوانة, while the other is concave surface to fit the cylindrical surface of the other bones. The example of that is elbow joint, المرفق. Movement across this joint is a uniaxial movement in terms of flexion and extension. There's no rotation at hinge joints. This is hinge joint. The third one is called pivot. Pivot يعني محوري. And the shape of the articulating surfaces is one of the bones is cylindrical, while the other surfaces is a ring-like structure surrounding the cylindrical head of the bone. Movement of this joint occurs across the longitudinal axis of the bone in a rotational movement. So it is a rotational movement, and again this is a uniaxial rotational movement. Example of that is a proximal radio-ulnar joint between the bones of the forearm. واحدة اسمها radius واحدة اسمها ulnar. So at this joint the movements of pronation and supination occurs. Remember the rotational movement of the hand and forearm, pronation and supination occur. This is pivot synovial joint. Ball and socket, and as the name implies, ball means كرة, cylindrical surface, or sorry, spherical surface, بيضاوي, and socket, concavity that resembles the ball joints. Example of that is shoulder joint, hip joint, also another ball and socket joint. This joint is a multi-axial joint, moves in more than three or more than planes. In the shoulder there's a flexion, extension, abduction, adduction, medial and lateral rotation, and circumduction. Speaking of circumduction and rotation, by the way, rotation differs from circumduction. Rotation occurs along the longitudinal axis of the bone. Bone in this case is the humerus. So the movement across the longitudinal axis of the humerus is called rotation. However, combination of flexion, abduction, adduction, and extension is called circumduction. So circumduction and rotation are two different things. Just to bear in your mind. This is ball and socket joint. The next joint is called ellipsoid joint. Ellipsoid يعني قطع بيضاوي, oval in shape. It resembles the ball and socket. However, instead of the spherical surface, we have an ellipsoid or ellipse surfaces. Example of this joint is the wrist joint, مفصل الرسغ. At this joint, there's a biaxial movement. in terms of flexion, extension, abduction, and adduction with some circumduction. And circumduction again is a combination of flexion and extension plus abduction and adduction. There's no rotational movement occurs across this joint. Why? Because if you can imagine, there's no limited rotational movement between the oval convex surface and concave surface. This is the ellipsoid joint. The next type of joint is called saddle joint, and saddle means sarj al-hisan, because the articulating surfaces are resembling a saddle and they have reciprocal shapes. Reciprocal يعني متبادلة. There is a concavity تقعر and convexity تحدب at the same surface. نفس السطح the concavity and convexity. It's a rare joint actually in the body. There's one example, and it is a carpo-metacarpal joint of the thumb. The joints between the carpal bones of the wrist and the metacarpal bones of the first finger of the hands called thumb, the palm. And this is a very mobile joint. It's a multi-axial, moves in flexion, extension, abduction, adduction, rotation, some rotation, and circumduction. So it's a multi-axial joint. Next joint is the condyloid joint. It's a multi-axial joint, moves in flexion, extension, again abduction, adduction, some limited rotation and circumduction. Example of condyloid joint is the metacarpophalangeal, is the joint between the metacarpal bones of the fingers of the hand and the phalanges of the fingers of the hand. Blood and nerve supply follows a law, قانون, called Hilton's law. Hilton's law states that the nerve or nerves supplying muscles acting across a joint also supply the joint itself. العصب اللي يغذي لي العضلات اللي تشتغل على مفصل أيضا يغذي لي المفصل نفسه. While the blood vessels that cross the joints اللي تعبر المفصل, they give blood supply to the joint. This is Hilton's law. Other type of joints is the solid joints, and according to the connective tissue that binds the articulating surfaces is divided into fibrous and cartilaginous joints. Fibrous example is like sutures between the bones of the skull, and a fibrous membrane that connects two adjacent bones, نسميها syndesmosis, between like joints between radius and ulna. Cartilaginous joints are two types, either primary called synchondrosis. Chondro means cartilage, like osteo means bones, chondro means cartilage, just to remember. Example of this is the joints of synchondrosis between the epiphyses and the diaphyses of long bones, and this is called the epiphyseal growth plate. Growth plate لأن هذه joints get ossified and closed when reaching the puberty. خلاص بعد نوصل النضوج ما يصير بها growth، ما يصير بها نمو ولا الشخص يطول. These are the synchondroses. Other type is the secondary cartilaginous joints called symphysis. Example هو joints اللي between the bodies of the vertebrae called intervertebral discs, and the pubic symphysis between the pubic bones of the pelvic bones, between the bones of the عظام الحوض. This is the end of our lecture. Thank you.